Good day, students, and welcome to today's webinar on trauma and adjustment. I'm Bianca Brits, registered counselor on Vanderbijl Park campus, and joining me today is student counselor Masilu from Mafeking campus and Karen, counseling psychologist from Potchefstroom campus. Today we will be looking at trauma and adjustment, as well as we all experience some form of trauma in our lives and have to adjust to new situations. Today's topic will cover the following outcomes: the definition of adjustment and trauma, looking at the symptoms of adjustment and trauma, what is the overlap and difference between adjustment and trauma, coping mechanisms, when do I seek professional help, and when do I refer someone for professional help, and lastly, where do I seek help or refer someone for help? So, firstly, with the definition of adjustment and trauma.
Thank you, Bianca. As Bianca stated earlier, my name is Masilu Mafokwane, student counselor at the Mafeking campus. I'm going to be looking at the definition of adjustment and trauma, as well as symptoms of both. Let's start with the adjustment disorder. Adjustment disorder is recognized as a stress response syndrome, which is defined as a maladaptive reaction to an identifiable stressor. The ICD-11 classified as stress-related disorder. The stress either an unexpected or unexpected event that causes confusion to one's life. For example, we all have been affected by COVID-19, right, as students and everybody else in the country. So I chose this example because most people can relate to it, and it's something that was unexpected. So COVID-19, social distancing for students, the introduction of online learning could also cause an adjustment. Breakup of a relationship, loss of income, re-entering parents' home, such as having been at university. Because often you find students spend more time at home, at varsity than they do at home. So sometimes having to spend, an unidentifiable number of days at home can cause somewhat an adjustment. Let's move on to trauma. Trauma is a response to a deeply distressing or disturbing event that overwhelms an individual's ability to cope, causes feelings of helplessness, diminish their sense of self, and the ability to feel the full range of emotions and experience. We also have vicarious trauma, which means a person develops trauma symptoms from close contact with someone who has experienced a traumatic event. Could be a friend, could be a family member, because most people don't know there's something as vicarious trauma exists. It does exist. You have a family member or a friend who just experienced an extreme trauma, and they share the events of that day with you. Vicarious trauma basically means you can get trauma from that, even if you were not there yourself to experience it firsthand. We can then move on to the symptoms of adjustment and trauma. What are the symptoms of adjustment disorder? Feeling of hopelessness or not enjoying things you used to enjoy. It could be soccer, it could be listening to music, it could be anything that you would normally do on a daily basis, and you didn't find yourself sad. Most of the times you are sad, you're crying, you experience anxiety, headaches or stomach aches, trouble sleep. Sometimes it's either you sleep late or you oversleep. Lack of appetite, you don't enjoy food anymore, difficulty functioning in daily activities. If you are a very functional person, maybe you like waking up in the morning, you find that energy is gone, you no longer have interest. Withdrawing from social support, it could be anything social, could even be sitting with parents or friends just for fun. Suicidal thoughts or behavior, avoiding important things such as schoolwork. Trauma symptoms, wait, before I go on to trauma. Adjustment disorder can present itself for about 3 months. Longer than 3 months. So if the stressor is ongoing, chronic adjustment disorder can continue for more than 6 months. That's where consultations with a professional would have to occur. Let's move on to trauma. Trauma symptoms are denial, anger, fear, sadness, shame, confusion, anxiety, depression, numbness, guilt, hopelessness, irritability, difficulty concentrating. Sometimes you'll find that you're struggling event, and especially process, you can feel any of the symptoms, and sometimes you're not going to feel all of them. You'll feel some of them, and some of them won't pretty much present itself, because remember, it is not one size fits all approach. Just because I feel anger doesn't necessarily mean every time they say I'm trauma, then I'll feel anger. Sometimes you might just feel one or two of the symptoms. Physical responses like fatigue, racing heart, sweating, feeling jumpy, dizziness, altered sleep patterns, and change of appetite. Those are some of the things that you can feel. Like I said earlier, you're not going to feel all of them at the same time. Sometimes you may feel some of you may feel some of you may not feel some. Now I'll hand over to Karen Pretorius, who will talk about the difference between adjustment and trauma. Karen, take it away.
Thank you, Masilu. It's very important to note what these symptoms is that Masilu explained to us. It's important that we understand how may we react to adjustment and trauma. And I'm guessing that some of the other questions that you guys have at this stage is, why are we discussing adjustment and trauma together? It's important to note that sometimes adjusting to a big life event can lead to trauma, and trauma can also in return mean that there's a big adjustment to the way in which our lives have changed. So if we look at the ways in which it overlaps, and what is the overlap and what is the difference between the two, and why are we discussing and explaining them together? Challenges to adjustment can sometimes be traumatic to some individuals, while trauma can also be a huge adjusting to the different way in which we have to approach our lives after a big traumatic event. How adjustment or trauma is perceived is subjective. This is very, very important that we know this. For example, going through a trauma may not mean the same thing to one person as it does to the other. One person may react very severely while another one isn't that affected at all. Then at another stage in a life, these same two people may go through a trauma again, while then the other one reacts more severely than the other person does. So it's dependent on a whole lot of different things. Our coping mechanisms at that moment when we go through the adjustment or the trauma also plays a huge part in how we react or how severe we perceive the adjustment or the trauma in our lives are. So adjustment is after a big or a small change in a person's life event. For example, moving to another city, or it could be course changes. All of us went through a huge adjustment period through this COVID-19 time. Trauma can happen unexpectedly, so it has a more unexpected part to it than adjustment does. For example, going through a robbery or a motor vehicle accident or a sexual offense. It's important that we discuss trauma and adjustment, especially in the context where we find ourselves. South Africa, unfortunately, has huge crime rates, and all of us, most adults living in South Africa, gets exposed to trauma and adjustment at one period or another in their life. Adjustment can be a normal life transition for some individuals, while others may experience it as extremely distressful. For example, leaving your hometown behind and having to move to another city in order to study or to attend university. That could be a huge adjustment period. Even after a breakup and having to adjust to life differently due to the fact that that this person that you spent most of your life with is not there anymore. Whereas trauma can be life-threatening. Trauma can also not be life-threatening. For example, the same example that I used with adjustment, the ending of a relationship can also be traumatic to one person, as another might just experience it as an adjustment period. Adjustment, as Masilu also explained, cannot necessarily persist longer than 6 months. Trauma can persist for a prolonged period of time. So trauma would be effects, the psychological effects after a big traumatic event someone went through. Then what is the overlap? Not all people who go through big change or traumatic event develops adjustment or trauma challenges. And with these challenges, I specifically refer to symptoms. The symptoms that Masilo explained earlier, we find in the DSM or the ICD codes. Someone going through an adjustment may not present with all of that challenges, or their coping mechanisms would be effective enough at that moment to not experience any of the symptoms. The development thereof can be prohibited by a person's internal or external strengths, aka the coping mechanisms that I just spoke about. But it's very, very important to know that both of these causes a lot of distress. Distress referring to the internal feeling or psychological effects of it. So a person would experience themselves having a low mood or high anxiety or something along those lines. Then I'm going to hand over to Bianca, and she's going to tell us a bit about the coping mechanisms that we just discussed.
Thank you, Karen. A coping mechanism is any effort we direct towards managing a stressful event or a trauma. Coping mechanisms can also be described as a survival skill, as they are the strategies that people use in order to deal with stress, pain, and natural changes that we experience in life. Coping mechanisms are learned behavioral patterns we use to cope, but we can also learn from others ways to manage our stresses. There are positive and negative coping mechanisms. Let's have a look at the positive coping mechanisms. One would be grounding skills. This is staying focused on your immediate surroundings, using your 5 senses to ground yourself within the present moment. Next is stress management. Take a few deep breaths and use your breathing exercises to help you cope with the difficult situation you're facing. Introspection is also helpful, where you get to know yourself a bit better, either via journaling, or talking to someone, or just sitting and reflecting on your life thus far. Don't forget about support from family and friends, or even a professional. Communication is important. Talk about your feelings. Even though this might feel uncomfortable, it's very helpful to use it as a coping mechanism. Communication doesn't always have to be talking. It can be writing about your emotions as well. Do some physical activity, working out or participating in sport. Cultivate healthy habits. This includes your sleeping habits, but also your eating style will help you to feel more grounded, thus helping you to cope better with difficult life situations. Trying something new, like a hobby, will also help you to gain some new perspectives. Try something like cooking, sewing, or even participating in a new sport that you didn't consider before. Learn forgiveness and acceptance. Expand your knowledge. Do this by reading about what's going on in your current life situations. The more you know and understand, the better equipped you will be to handle any life situation. Use some positive self-talk. Meditate and use some mindfulness exercises. Set those goals to help you to move forward and to become more focused on your life. Never forget about self-care. It's very important to first take care of yourself before you're able to take care of others. And then lastly, volunteering your time. Volunteering makes us gain some new perspective, and it also gives us some gratefulness or gratitude, which we can then direct inwards to help ourselves to cope better with difficult situations. We also have negative coping mechanisms. These usually include violence and abuse, either attacking someone physically or verbally, acting out, being impulsive, making impulsive decisions, and misbehavior on purpose. It sometimes looks as being passive, actively not trying to cope and always being the victim. addiction. This includes drugs, alcohol, gambling, medication, etc. We sometimes minimize the things that we are going through. So telling ourselves that they're not that bad, or it's not really something to concern ourselves about. But also sometimes we rationalize the situation, saying, for instance, that that person didn't know any better, or I didn't know any better. Sometimes we use denial to cope. This is where we don't see the problem, or we convince ourselves that there is no problem at all. Sometimes we also divert to repression. Repression is where we would forget about a trauma and completely erase it out of our brains. This is our brain that usually steps in to protect ourselves when we're dealing with a severe life-threatening trauma. Unfortunately, we as people can't just forget by turning on a switch. So repression is our brain taking over to protect us. Then there's also dissociation, where we space out and we use thinking, not feeling. Self-harm and suicide, diverting to controlling behavior, isolating and withdrawing ourselves, blaming others, lying or manipulating the situation, and depression. So many people use their coping mechanisms to benefit them in a positive way. However, we are not always able to cope with the difficulties we face and thus resolve to the negative coping mechanisms. It is sometimes hard to know when our adjustment and trauma are serious. So next up, Karen will talk a bit about when do you seek professional help and when do you refer someone to professional help. Thank you, Karen.
Thank you, Bianca. This is important that you know that you are not alone in this process. When you feel overwhelmed by some of the symptoms, or even if you recognize some of the negative coping mechanisms in yourself that Bianca spoke about, or the symptoms that Marcelo spoke about, please reach out to us. Reach out to the different student counseling and development centers on your campus so that you can know that there's people that will support you and that will assist you through this difficult time period in your life. So when do I need to seek professional help and when do I need to refer someone to professionals? Some risk factors are important to keep in mind and when noticed to seek professional help. Don't wait too long to talk to a professional. It's important to know that some of these symptoms or some of these trauma symptoms or the after effects of the adjustment or the trauma can then later in life lead to more difficulties or even other psychological disorders. So please don't wait too long. Rather reach out to a professional or anyone that you trust. You'll also note later on that there's a lot of toll-free helplines throughout South Africa that assists on this specific issues. So if you don't necessarily want to reach out to student counseling centers, reach out to some of these other professionals just for someone to assist you through this period. When these symptoms prolong, so when it keeps on happening and the symptoms does not ease, it could lead to other mental disorders or could coexist or exist comorbidly with others. Some risk factors to look out for: changes in behavior, aggressiveness, substance use or abuse, or the increase of substance use, agitation, hypervigilance. So this is where you would constantly be aware of your environment and to a certain extent scared and afraid of your environment, of something bad happening. Excessive tiredness, weight changes as a result of eating more or eating less, isolation, so not spending time with loved ones, changes in emotions, tearfulness, excessive anxiety and feelings of worthlessness or helplessness or hopelessness, changes in thought patterns, suddenly thinking everything is your fault or the world is all bad, not being able to see that there's also good in this world and that also something bad is going to happen. So that constant feeling of something bad is going to happen as life does not hold good for you. Other red flags, important to notice, this was also discussed earlier: suicidal thoughts or suicidal ideation, either noticed in yourself or in a loved one, nightmares that persist, avoidance behavior, so avoiding going to a certain area that reminds you of the adjustment or the trauma, or avoiding, for example, getting into a car to drive somewhere because of a car accident trauma, excessive changes in emotions, and feelings as if emotions is out of control. So as if you can't control your own emotions, or if a loved one is not able to control their own emotions. Referral platforms, student counseling and development centers. Bianca is on the Vaal campus. I'm on the Potchefstroom campus, and Masilu is on the Mafeking campus. We are just part of a bigger team on these campuses within the student counseling and development centers that provides vast assistance and help in periods like these. So you'll note that Mafeking campus is open 24, or there's an emergency line that's available 24/7, but they're open normally during office hours. On the Potchefstroom campus the same, and on the Vaal campus it's also the same during office hours, and then there's contact details for emergencies as well as normal therapy queries during office hours. If you do feel like you want to make a booking, please visit eFundi, the website. You'll see that there's very clear instructions as to how to go about to make a booking. You choose your campus where you are on, and then you pick a time and a therapist that works for you best, and then further communication will be between you and that therapist in order to provide assistance. So this is how it would look like on the referral platform eFundi. To book an appointment, you need to visit eFundi. Then you select your campus, you complete the steps, and then you make a booking. It's as easy as that. More information, eFundi, you'll see if you access our website, there's vast resources for other mental health challenges as well. More information on anxiety and sleeping patterns, and even course changes and sexuality and all of that, you'll find that there's more information on that. So if there's anything else that you would also like to know more about, just access eFundi or visit our Facebook page. You'll see that there's more information as regards to where you can get more education on relevant psychological topics. Thank you so much. I want to thank my colleagues. Thank you, Bianca. Thank you, Masilu. And then I really, really hope that this benefited you as a student in some way or other, even if it's for you personally, or if it's for you understanding a friend or a family member better after reading through this. If there's anything that's still unclear to you, please reach out to us. But thank you very much for taking the time to look at this and read through some of the resources. Thank you.
Thank you.
Thank you.